X-rays are electromagnetic waves. It's energy. We know that we have got ultraviolet rays, heat rays, microwave rays. Like that, X-rays also radiations. But X-rays can do good and can do bad also if used extensively and indiscriminately. Nobody wants X-rays just for pleasure. It's only when there is disease. And in war days, actually it is discovered by one physicist, German physicist, Sir Wilhelm Conrad Roentgen. He discovered the X-rays accidentally. He is a physicist. He was doing some experiments in the basement and suddenly he saw certain rays. Then he didn't know what to call it, so called X-rays. That is the meaning of X-rays. And then it has got several changes, several reforms, several advances as days goes by. And today we take safety measures for X-ray radiation, particularly in children and in pregnant women. They are very sensitive to even a minimum dose of X-rays. That's why we avoid taking X-rays in pregnant women. Today, ultrasonography replaces X-rays in pregnant women, but in children, there are certain areas, for example, chest, you have to take X-rays. So use as far as possible, there is what is called LRR principle. Radiation should be as low as possible. That's how we use X-rays. And now what are X-rays used for? Anything from head to toe. Not only for bones. Bones are dense on X-ray, but others, lungs, abdomen, brain, all these are used for X-rays. What are the advances in X-rays? Now today we have got CT scan. It is nothing but multiple X-ray tubes. Cross section also you can take. Sagittal section you can take. And in the use of X-rays, I will tell you an anecdote. In 1957, I was an honorary radiologist at Usmania General Hospital. An MLA has brought his wife for taking an X-ray of the chest. We have taken X-ray of the chest. Sir, can you take my X-ray also? Certainly. Then he said, my cook has come. Will you take an X-ray of the chest? I said, shall I take a group photo? Yes, sir, that will be nice, he said. I mean, he didn't understand what X-rays are, what group. Being an MLA, that was the education about X-rays in those days. But today, almost everybody knows, because the other day we had a camp and the one old lady, about a 80-year-old lady asked me, Sir, would you scan my chest? So they understand what the principles of X-rays are. So today it is all advanced X-rays, and I told you about the safety of X-rays. In order to, the radiologist, radiographer, we call the technician radiographer, and the doctor who practices radiology is called radiologist. Not only MBBS, he should be 4 years experience in radiology. Again, I may tell you, there are two types of X-rays. One, earlier we used to use deep X-rays, that is more penetrating. We used to use it for cancer. Nowadays we don't use them. We only use 120 kV up to 120 kV X-rays for diagnostic purposes. And for example, you might have seen a X-ray of the chest. There, the lungs, because they contain air, they look black. And the ribs and sternum and scapula, clavicle, they look white because they are bones, they are dense, they absorb the least, and the rays falling on the photographic plate are few. That's why they look white. Lungs look dark. In between, you see some muscles, they are gray. So in X-rays, there are 3 shades, black, white, and in between gray. With these 3 shades, the expert radiologist studies the X-rays, and he doesn't just look at the X-ray and make a diagnosis. Certain diagnosis can be made, but he has to have the clinical history. Sometimes he has to examine the patient, and then only he can give a definite reply. Today, the radiologist called consultant for consultants, because who consults him? Not just MBBS doctors, all the specialists, cardiology specialists, brain specialists, gastroenterology specialists, everybody consults him, orthopedists particularly consult him. Please, this is the history of the patient. He has got pain in the knee. you have taken X-ray, what is the diagnosis? But certain times, particularly bone tumors, radiologists cannot make a definitive X-ray. Then they take a piece from the tumor and send it to the pathologist, and they correlate with the radiological findings and give a final diagnosis. That's how the X-rays have advanced so far. Thank you for listening.